and thank you very much for presenting me in that way. And I will just say I'm humbled, because what I do and what I've dedicated my life to is to serve women and girls and defending their human rights. And that's the shortest version and the one that I would strictly adhere to, but thank you so much. Honorable panelists, fellow panelists, please allow me to stand on the established protocol this morning. And thank you again for inviting me to join this panel. I would like to start by saying that eliminating FGM is an essential step to realizing many of the other Sustainable Development Goals. And we often focus on that. But more importantly, I think we all have to remember that female genital mutilation is a gross human rights violation. It is a practice that deprives women and girls from their human rights on so many levels. It deprives them on their inherent right to dignity. It deprives them of the right to bodily integrity. And it very often is also a huge contributor to depriving women and girls for the right to make their own decisions about their own lives and realizing their full potential. While they, on an overall socioeconomic level, contribute directly, eliminating FGM would contribute directly to the elimination of so many violations. It would also help us, of course, to reach SDGs such as the right to health, the rights to well-being, the rights to quality education, to gender equality, decent work, and economic growth. We all know that women and girls play a crucial role for the betterment of any society. There's a reason we have a saying that if you invest in a woman, you invest in a family, and you invest in society and community. While the practice of female genital mutilation sadly continues, and also sadly I have to say here that Nigeria contributes approximately 10% of the global burden, girls and women continue to be denied quality education. They continue to be denied opportunities for decent work, and their health, including their sexual reproductive health and well-being, is threatened. It is also against their human rights to, as I said earlier, bodily integrity. And I keep repeating this because it's important that we remember this. We must never just discard it as a cultural or traditional practice. It is indeed a violation of human rights. So for the million of girls that is currently at risk of female genital mutilation, this new global goal of eliminating harmful practices and gender-based violence brings also the promise of a better future. We have made many promises to women and girls over the years. And in UNFPA, we are determined to deliver our promises. We cannot continue to make promises we do not deliver on. Ending harmful practices and gender-based violence by 2030 is one of our transformational goals. And we know that will be transformational for any society, also for the Nigerian. In Nigeria, according to the 2018 Demographic Health Survey, an overall of 20% of women between 15 and 49 years have been exposed to female genital mutilation. So that is, I will have to give credit for that, a slight decrease on 5% points since the 2013 National Demographic Health Survey. So across the 5 UNFPA UNICEF joint program for the elimination of female genital mutilation intervention states, the FGM prevalence for women in the same age group from 15 to 49 is on a slight downward slope, some more than others, although it is still unacceptably high across the states. So I'm going to give you some stats here, and they're never, you know, we never really want to listen to them, but these are important numbers because they really tell a story. So in Osun State, in that period, we went down from 78% to 45.9%. In Ebonyi State, 74% to 53.2%. Ekiti State, 72% to 57.9%. And in Imo State, 68% to 61%. And in Oyo State, from 66% to 31.1%. Oyo State halved the prevalence. So the numbers are still concerningly high. And unfortunately, we also know that to eliminate FGM by 2030, we have to work 10 times faster than we are doing now. We talk a lot about pandemic, and we all do suffer a pandemic right now. And we've seen the spike in gender-based violence. Unfortunately, we also see an increase in FGM. Reports during the lockdown measures introduced to curb the COVID-19 pandemic showed, as we all know, an alarming increase in violence against women. So accompanying this crisis has been a spike in domestic violence reporting at the exact time that the services and rule of law, health and shelters are being diverted to address the pandemic. This was stated in the Secretary General's report. And he also continues shared responsibility, global solidarity, responding to the socioeconomic impacts of COVID-19. That's the name of the report, and that is what we aim to do. COVID-19 is threatening to reverse the progress we have made towards achieving the Sustainable Development Goal 5 for gender equality. And of course, in specifically the target 5.3, which is the elimination of female genital mutilation. And today is a call for greater action. According to UNESCO, at least 11 million girls are at risk of never returning to schools as a result of the COVID-19 pandemic. This will affect globally, therefore also in Nigeria, future generation of girls, because we know that less educated women are more likely to support the continuation of female genital mutilation. Education is critical in ending this. In continuation of this, the United Nations Population Fund's UNFPA, we've also modeled this, and we estimate that an additional 2 million girls are at risk of female genital mutilation over the next decade as a result of the global coronavirus pandemic. And in Nigeria, FGM amongst girls from 0 to 14 years is most common where the mothers are circumcised. That is 56% of the cases, whose mothers have no education, and those from the lowest wealth quintiles. These also represent the quintile that will have less access to sexual and reproductive health care, including safe and skilled birth attendance. In Nigeria, some of the harmful practices that predispose girls and women to developing obstetric fistula include early marriage, the absence of family planning, and female genital mutilation. Indeed, while obstructed or prolonged labor and women are unable to obtain adequate emergency obstetric services at the time of delivery, cause an estimated 75 to 97% risk of obstetric fistula. And FGM is also a recognized predisposing factor, especially for girls and women with type 3 FGM, due to higher risk of obstructed labor and other types of complications such as keloids and scarring around the introitus. And if I put that into plain language, it means that if women have been exposed to female genital mutilation, they were cut when they were children. They are likely to get a disability or morbidity when they deliver. They are more likely to die during delivery. And when the labor is obstructed and they need help, they are cut yet again in order to deliver a child. Increasing family planning, uptake, and elimination of harmful practices of female genital mutilation. That would reduce the number of new cases of obstetric fistula, and it would also reduce maternal mortality. The list of reasons why ending FGM is so important, in addition to ending human rights violations, is so long. It benefits to better health, to better wealth, to better social development. There's so many reasons why we have to end this. And this is reasons that no one can really say they don't want. Because who can honestly say that a child should be born as an orphan because we didn't end a violent practice? Female genital mutilation is a human rights violation. Here I said it again. And it is a practice that must end. It is violence and it harms women and girls. Therefore, we must unite. And we must unite by increasing our collaboration for sustainable development and leverage resources and think through how we can ensure maximum impact of our programs. And we have to expand together for global and national advocacy to end female genital mutilation. And we have to empower girls and women in an environment where they feel safe and are safe. We must fund and mobilize resources together, united. And we need all to act. We need all to say, stop, no more. We are ending female genital mutilation. And we are doing that because we want to deliver on SDG 5, on target 5.3, and because women and girls are amongst the most vulnerable, the hardest to reach, and we will not leave them behind. Thank you for listening to me.